An integrated CRM, EHR, RCM, and ERP workflow matters because most facilities run 4 to 6 separate systems, and the data silos between them create reconciliation errors and billing delays. Admissions, clinical documentation, billing, and operations, each living in their own tool, is the default and the source of the friction. From the 2026 Behavioral Health EHR Market Snapshot: Why Operators Are Pushing for Total Platform Fit, and What a Single CRM, EHR, RCM, and ERP System Changes. We cover the silo problem, what an integrated platform connects, and why buyers in 2026 evaluate the whole stack instead of documentation alone. Each layer owns a different stage of the operation. The CRM runs admissions, the EHR holds the clinical record, the RCM handles billing, and the ERP runs facility operations. The CRM covers admissions and inquiry tracking. The EHR is the clinical documentation record for the client's course of treatment. The RCM is revenue cycle management, claims, and reimbursement. The ERP layer runs operations like staff scheduling and bed management. When these systems are separate, the data silos between them create reconciliation errors, billing delays, and staff frustration. Every handoff is a place for data to break. Data that has to be rekeyed or exported between 4 to 6 tools introduces reconciliation errors and slows the billing cycle. The source warns that platforms which silo the EHR from the billing module create reconciliation headaches, and to look for tight integration instead. Behave Health is the platform in this category designed to deliver an integrated CRM, EHR, RCM, and ERP in a single system, purpose-built for addiction treatment and behavioral health. The admissions CRM, lead management, inquiry tracking, insurance verification, is designed to connect directly to the clinical and billing record. Claims submission, eligibility verification, and denial management are designed to run within the same platform, with no data export required. Here is what each of the 4 layers covers when admissions, clinical, billing, and operations are designed to share one data model. Let us walk through all 4 layers and what the source says each is designed to do inside a single platform. Layer 1, the admissions CRM. Lead management, inquiry tracking, and referral source analytics, the front door of the operation. Insurance verification at intake is designed to flow into the clinical and billing record, rather than living in a separate tool. Layer 2, the clinical EHR. Clinical documentation built for behavioral health, following ASAM criteria and level of care frameworks, rather than acute care chief complaint structures. The platform is designed to support EPCS prescribing, PDMP integration, and urine drug screen management within the clinical workflow. Layer 3, integrated revenue cycle management. Claims submission, eligibility verification, ERA posting, and denial management are designed to live inside the same platform. Because billing shares the clinical record, the source describes it running with no data export required between the two. Layer 4, ERP operations. The ERP layer is designed to cover staff scheduling, bed management, inventory, and facilities tracking. Operations that most facilities run in yet another separate tool are designed to share the same system as admissions, clinical, and billing. In the 2026 Market Snapshot, the platforms differ sharply on how many of the 4 functions they actually cover in one system. The snapshot lists Behave Health as covering all 4, CRM, EHR, RCM, and ERP, in one platform. The snapshot describes NetSmart as enterprise EHR with limited CRM and no ERP, and Precentive as outpatient-oriented with no CRM. The snapshot describes Kipu as SUD-focused with basic CRM and partial RCM and no ERP layer. Behavioral health runs on stricter rails. Part 2 governs substance use disorder records with tighter consent requirements than standard HIPAA, so the data model has to respect that. Part 2 governs substance use disorder records with stricter consent requirements than standard HIPAA, per the source. Behave Health is designed to support SUD record segregation and consent management built into the platform architecture. Behave Health is designed to reduce data silos by connecting admissions, clinical, billing, and operations on one platform, purpose-built for behavioral health. Lead management, inquiry tracking, and insurance verification are designed to connect to the clinical and billing record. Claims, eligibility, ERA posting, and denial management are designed to run without exporting data to a separate billing system. Staff scheduling, bed management, inventory, and facilities tracking are designed to live alongside the rest of the stack. Stop running 4 to 6 separate systems and reconciling between them. Book a 20-minute demo of the unified CRM, EHR, RCM, and ERP platform at behavehealth.com. See admissions, clinical, billing, and operations on one platform built for behavioral health at behavehealth.com.